Hi, everyone. This is Julie Yoo. I'm a partner on the A16Z Bio Fund. And after several years of being a healthcare entrepreneur myself, I am very excited to be here at the firm to partner with the next generation of great entrepreneurs going after the massive problems that currently exist in the healthcare space. We think right now is a particularly transformative moment in the healthcare market. And I'm excited to tell you some of the reasons why we think that's the case. What are some of the tailwinds that are creating this unique moment in healthcare for tech startups to get started and scaled? What are the specific zones of opportunity that we think are particularly ripe for companies to have an impact and get started? And finally, we'll give you some insight into what we think about when we're meeting with companies and evaluating investment opportunities, and some of the characteristics that we think will make for a winning formula in this space. And I'll start by saying that, what's great about healthcare is that in many ways it is the truly holy grail of the application of technology. And, healthcare is a super stressful and operationally complex environment. Typically, patients who are encountering the healthcare system are in a vulnerable state, are, in a dire state of need, and face a tremendous amount of information asymmetry, of inefficiency, lack of transparency, et cetera. And all of those are the types of characteristics that are highly conducive to the application of technology. And it's not just the patient side. We think a lot about the provider and the delivery side as well, and how, so much of the conversation has been around, will the robots and will AI replace doctors eventually? And, we think that, the right conversation to have there is, what if robots were actually able to automate away the, 80 to 90% of things that doctors have to do or frontline staff have to do that really take away from the human experience that they could otherwise be providing to their customers. And therein is where we think the huge opportunity is for tech startups to really make a difference. So why now? So one of the major tailwinds that we're excited about is the fact that an entire layer of infrastructure has now been laid down in the market that allows us to lift our heads up and look towards the higher order use cases and application areas that are possible. And what I'm referring to there is really the laying down of electronic health records in the provider market and many of the core systems on the payer side that are creating these systems of record that are very good at storing data. What they're not so great at is creating interoperability, of creating data liquidity. And that, as you can see here in phase 2, is one of the big areas of opportunity that we see for startups today is, how do I create liquidity around clinical data, around administrative data, around transactional interactions, and essentially take the form of APIs or other types of platform companies that are kind of the bus between all the different service providers and stakeholders in the space. And, it's really with the laying down of that layer of interoperability that we believe companies can truly go after the engagement opportunity set. The second tailwind here is one that I'm particularly excited about, this notion of the unbundling of the hospital. And that this concept is really, us as patients used to have to travel downtown to these sort of monolithic acute care facilities called hospitals to get any kind of care service. And what used to require us to go there is now more and more being made available to us in far more convenient, accessible, and affordable ways. And we see two big sort of business model trends occurring with that tailwind. One is the emergence of novel access points, so novel ways that we as consumers can get access to care, whether it be things like virtual care, retail clinics, clinics out in our community-based settings, typically associated with some kind of retail presence that allows us to not only go shopping for our groceries, but also get, our primary care needs taken care of. And then home care is another big trend. What used to require patients to sort of stay for multiple days on end in the hospital can now be moved out into the home setting, which is not only more convenient and comfortable for the patient, it's also potentially safer for the patient because they're not exposed to other sick patients, potential infection risk, things of that sort. And all of that is enabled by novel technologies that have remote monitoring capabilities and things of that sort. On the other end of the spectrum, another set of business models we see being enabled here are vertical full stack models. And these are notions of companies sort of targeting specific subpopulations of patients who are characterized by either a disease or a certain level of need, and essentially building full stack managed services that are completely expert end-to-end providers for those patient populations. And those companies become super specialized around those populations and basically can take on risk and be far more aggressive about how they think about investing in making those patients better or keeping them well. And then the final tailwind that we think a lot about is consumerism. And it's really not consumerism in and of itself that is the tailwind, but rather the confluence of several factors that have sort of compelled stakeholders to take a far more patient-centric and consumer-centric approach to how they're doing things. First and foremost, we as consumers are definitely bearing more of the financial burden out of pocket for our healthcare needs. What used to be either reimbursed by our employers or health plans is now sort of shifting to our pockets. And at the same time, the experience that we receive, if we're going to pay more, we probably expect more from an experience perspective and a quality perspective. But when we compare the experience that we have with healthcare to other aspects of our lives where, our experience in retail and travel and general transportation has just, been 10x in the last, several years, that gap between those experiences is at a breaking point where consumers are just exasperated with what they're getting in healthcare. And as such, the service providers in the market, so, health systems and provider organizations, are feeling the pressure to really compete for our business. And it's not only that their reimbursements are shrinking and that the dynamics on the reimbursement side are very uncertain, but also that there's new entrants in the market, whether it be, tech companies or, the Walmarts of the world who are coming aggressively after some of the lower acuity areas of the market. That's forcing, it's a forcing function for service providers to really rethink the way that they're doing business. So all of that activity and all those macro trends are really creating this unique moment for technology companies and really iconic digital native companies to be built in a number of areas of the market that we're excited about. So what are some of the areas of the market that we think will be transformed by this next generation of companies? First, we think a lot about companies who are transforming the way that we access care. So these companies are essentially creating the new front door experience to healthcare. When you have a need, how do you understand what options are available to you, what is covered under your insurance, and what meets your preferences and your needs from a convenience perspective? So we'll double click into each one of these, but there are a number of categories of companies going after that opportunity set. The second category, and sort of adjacent to that, are companies that are transforming the way that care is paid for. And, this notion of Fintech for healthcare is one of the sort of most obvious low-hanging fruit opportunities for technology to be applied because it is a very high transaction area. And much of the activity that occurs in this area is highly administrative in nature. The final category is companies who are actually transforming the actual care delivery experience itself. So when you become a patient, how is technology transforming that experience, both for you as a patient, but also for the service provider? The way that we think about the segments of opportunity within access are twofold. One is there are different levels of acuity that need to be served for consumers. If I just need a flu shot or have a minor rash, my needs are going to be very different than if I've been diagnosed with cancer or have to undergo some very significant procedure. So level of acuity is one way we think about the market. And then correlated to that, highly correlated to that, is the willingness to shop. How much are you as a patient going to want to self-serve and find your own option versus relying on experts to guide you to the best option for you? And so we see a whole spectrum of companies along those two axes, as you can see here. We have companies also selling into different market segments. On the top row here, companies who sell into the plan sponsor space, so whether it be insurance companies or self-insured employers who are essentially bearing the risk for the outcomes and cost of different member populations. In the middle, you have companies who are going after the service provider brands, so to speak, so the health systems, the hospital networks, those who care about maintaining long-term relationships with their customers once they are acquired. And then finally, you have the notion of open marketplaces, which are essentially going after, sort of undifferentiated consumers who just want to shop and want to see all of the various options that are available to them in a given market. And closely related to that, once you've identified where you're going to get your care, you're going to care a lot about how that care is going to get paid for. And so the payment area or the Fintech for healthcare category, we see a particular opportunity around two dynamics. One is the fact that revenue cycle and sort of healthcare payments is one of the areas of industry that has the worst labor productivity. When you look at these stats, we are sort of 8x more non-productive than other sectors when it comes to number of FTEs who are affiliated with a certain level of revenue. Combine that with the fact that there is severe pricing complexity in our market. It's not very straightforward how to pay for things or what they cost. And the confluence of those two dynamics creates opportunity for a number of different companies to come in and both, number one, streamline the administrative processes by which payments are made. Many companies here in this first box going after everything from the patient billing experience to the provider-facing claim submission experience to, on the payer end of the stick, how claims are adjudicated and reimbursed. And some of these actually trying to forego or replace or get rid of the claims-based system altogether. And on the bottom here, we have companies who are actually creating novel coverage products or novel insurance capabilities or novel ways to sort of cover the expenses associated with healthcare. So lots of interesting dynamic-based pricing models there and far more transparency and flexibility for consumers getting their care paid for. And then finally, once you're able to access care, figure out how it's going to get paid for, then it ultimately boils down to, what is the experience that you actually receive when you get that service? And we see a whole spectrum of companies going after really the entirety of the patient journey, whether it be full stack providers who are taking on dedicated focus around certain disease areas or certain conditions or even certain sort of specific domains within healthcare like pharmacy, a number of digital pharmacy companies going towards sort of an e-commerce type model when it comes to managing your prescription drugs. We have companies here in the middle who are creating more horizontal platforms that create the connective tissue for communications between both patients and providers, as well as provider and other providers, between encounters across different care settings to really drive efficiency around the communication aspect of care coordination. And then finally, the actual sort of last mile of care delivery. We see lots of companies creating very compelling ways to automate aspects of the care delivery experience that get in the way of the patient-provider relationship, and also are leveraging AI in ways that sort of up the game, reduce variation, increase the ability to standardize, and and sort of guarantee to patients that they will all receive a certain bar of quality and service level, instead of sort of being at the at risk of high degrees of variation depending on what provider you see or what organization you go to for your care. So those are the areas that we're excited about. And, as we meet with entrepreneurs and evaluate companies, just some insights here as to what we look for. So it's kind of three buckets of things we look at and questions that we ask. One is, what is the actual form of the company? Because the form of the company can have, real implications on not only, growth opportunity, but also how we think about capitalizing the business. For instance, if you're a horizontal platform company that's primarily tech that is being deployed in some kind of API-based way or, sort of infrastructure-based way, that's going to have a very different financial profile than a full-stack managed services company that needs to put, potentially lots of feet on the street, folks in the field to support a services-oriented delivery model. The second set of things we ask are, what are the characteristics of the business that give it the potential to become really, really big? And, one thing that we look for is this business focused on a node of the healthcare space that has high volume transactions? So, we don't like to see things where the user, or it's more challenging to think about the opportunity for a type of product that's only used, once every few weeks or once a year for a given population of users versus things that are sort of sitting in the flow of hundreds or even thousands of transactions a day or, encounters a day. So that's certainly one thing that we index on. And then very closely associated with that is, because healthcare is such a razor-thin margin business, many times the buyers. And, we think more about kind of the B2B end of the spectrum when we ask these questions, but buyers are going to be very price sensitive and also will demand to see ROI, will be far more likely to buy into a solution if there's an immediate and very clear ROI. So we also look at, can your solution demonstrate a very clear ROI in a relatively fast fashion such that the expansion opportunity within that customer set is far more clear and has less friction around it. And then finally, business model is super important to us. It's very rare that we would see a company that fails solely because their product is poor. It's more often the fact that companies struggle and see the most challenges around distribution. We see tons of great products out there that haven't quite cracked the distribution nut as of yet. So, we ask a lot about what is your distribution edge? What are the things that you are doing on the channel side that sort of grease the wheels or, allow you to sort of defy gravity in some way, shape, or form as you sell into the B2B space. So it could be things like channel partnerships. It could be things like unique integrations that sort of get you into a certain ecosystem that reduce the risk of someone adopting your solution. Or it could be network effects that you're able to create through whether it be geographic density or user populations that are needing to interact with each other through your platform. So that is a major thing that we think about. And then quite obvious, but something that, is still worth mentioning given that it is such a services heavy sort of market, is this notion of a recurring revenue stream as the dominant way that you're making money. We say dominant because there are typically multiple revenue streams associated with some of these more complex businesses. And we always look to, make sure that we believe that the high leverage part of the revenue stream is something that is recurring and has some level of predictability. So in conclusion, in addition to the tailwinds that we mentioned earlier, one of the major reasons that we're super excited about the opportunity set right now for tech entrepreneurs in healthcare is that we're truly just at the beginning. We often talk about internally that we liken where digital health is to where the internet market was back in 1999, where core infrastructure is only just being laid down. And so the possibilities are just increasing exponentially as more and more of that infrastructure is becoming real. Companies and new market opportunities, we think, are severely undervalued at this point in time. And so there is really nothing but growth opportunity in many of the spaces that we talked about. Also, there was an early crop of digital native companies that have been formed in the last several years that are finally getting scale. And that's important both from a general proof point of the category and the market set, but also to increase the confidence of the buyers and other stakeholders who we're relying on to adopt these solutions. Oftentimes, success begets other success and or additional success. And we think that is going to be a critical part of what gets the flywheel spinning.